In 2017, the first global healthcare ranking report, based on a quantification of personal access and quality for 195 countries from 1990 to 2015, placed Nigeria at 140th position with 51 points on healthcare access and quality index. Every year, an estimated 500,000 Nigerians die as a result of medical misdiagnosis. This, according to health practitioner Ovie Ogono, has set the rating of our health sector back. To address this problem, he and his team have created an on-demand virtual primary healthcare system for Nigerians, a doctor in your pocket. Smart Health is a smartphone application that uses artificial intelligence which allows individuals receive medical diagnosis from their phones.
Technology being the way it is, we thought, well, what if we could create a platform where people could actually get high quality medical advice from their smartphones. And so rather than doing self-diagnosis, they can actually get a really good idea of what's wrong with them and be able to take it from there, and thereby saving, huge numbers of lives every year. It replicates a scenario whereby the user is speaking to a doctor, typically in a GP surgery, and they go for an intuitive kind of consultation where the app asks the user a specific question, they give a specific answer, and based on that answer, it imputes the next question to ask. And this process continues for up to maybe 15 to 20 different questions. And all the while, what the artificial intelligence is doing is calculating in the back end the probability of what your symptoms likely are.
In less than 2 minutes, the application provides users with an idea of what could be wrong with them and gives instructions on what to do next.
What SmartHub is really trying to do is to act as a virtual primary healthcare service where your first point of contact is, let me actually check and see what my symptoms really are. What do they mean? Is this something that's urgent? That's the first step. So you do it with the artificial intelligence. You don't have a second check. You can now have an immediate consultation with a real life doctor, telemedicine via your phone. So we've put a mechanism in place to filter the need to even go to hospitals in the first place. We can do nothing about the number of doctors that we have. Right? There's nothing we can do about that. But what we can do is we can make our doctors much more efficient. So for example, if we're combining our artificial intelligence with our doctors who are manning the phones, because each patient has first of all done that consultation, what it means is a face-to-face consultation that would normally take 40-45 minutes now takes just 5 minutes.
The app also links the user to medical caregivers for further follow-up. Users can connect with doctors, both foreign and local, to receive medical advice and prescriptions via video or voice calls from their homes. A patient also gets an exclusive discount of 10% when referred to an hospital, making it cost-effective and giving traffic to quality hospitals. It helps to stop self-medication and misdiagnosis of a patient.